our healthcare providers have to be a major, major part of the solution because, quite frankly, our healthcare providers have been a major part of the creation of the problem. And they need to be a part of the solution. 4 out of 5 new heroin addicts started with a prescription. And so what we know is that unlike lots of other drug issues we've had over the course of our country's history, this did not start south of the border. This did not start on some street corner. This started in doctors' offices and in hospitals all over this country. And we need to come to grips with that simple fact. That's why one of the President's Commission's recommendations, one of our recommendations, was the need for medical education, starting in medical school and continuing medical education to be able to renew your DEA license to write these prescriptions. Imagine, I haven't actively practiced law in the last 8 years. Yet for me to maintain my law license, every year I have to take continuing legal education. But doctors who write these prescriptions for drugs that addict and kill can continue to get their prescription license renewed time after time after time with no requirement for continuing medical education. And we see from the statistics that Dr. Gupta showed that this situation has evolved and worsened over time, which means that our physicians should have been told about the fact that they were contributing to the death of tens of thousands of Americans every year, and that maybe they needed to take a look at alternatives to what they were doing. That was not done, not required by the DEA, and that's why we've asked the President to require the DEA to have continuing medical education on the issues of addiction and opioid prescribing in order to qualify to get your DEA license and retain your DEA license.